Can I come in?
Come in.
Coming in, and I'm gonna go ahead and provide hand hygiene. I'm gonna close the door for privacy behind me. Hi, my name's Charissa. I'll be your nurse today. We're just gonna do a general survey, vital signs, skin and nails assessment. It should take about 15 minutes. Is that okay?
Okay.
All right, can you tell me your name and date of birth?
Maria Asuncion Maranan, August 15, 1954.
Perfect, it matches your name band. And I'm gonna ask you a few questions before we get started. Do you have any allergies to medications, drugs, latex, food?
No.
Having any pain on a pain scale of 0 to 10? 0 being no pain and 10 being the most pain, what would you rate your pain?
0.
All right, so taking a look at the patient's physical appearance, she looks consistent with her age and genetic background. I don't see any signs of acute distress or any visible devices such as canes, walkers, crutches, or prosthetics. I also noticed that the patient's alert. Again, can you tell me your name?
Maria Asuncion Maranan.
Do you know where you are?
Clinic.
Do you know the time or the day of the week or the date?
Today is Tuesday, January 18,
Okay.
2022.
All right, 2022.
7 o'clock.
All right. And do you know why you're here?
Check up.
All right. So patient is alerted, oriented ×4, and I'm going to take a look at the patient's behavior. So I'm going to take a look at her facial expressions, which she does maintain eye contact and is appropriate for the situation. She's calm and cooperative, and she does have a benign affect. Her speech is clear and articulate. She looks dressed appropriately for the weather and the situation, and she does look like she is well groomed. I am going to take a look at the patient's vital signs here. I'm going to take your temperature orally. It is 98.6 orally. I'm going to take your pulse with 2 fingers, and it is 68 beats per minute, regular. Then looking at her respirations, counting for a full minute, 16 unlabored and regular. Her blood pressure when I take it is 120/80, and once I put a pulse ox on her, take a look, and it is 99% in room air. So your vitals look great. I am going to go ahead and inspect your skin, and then I'm going to go ahead and take a look, and it does look appropriate for your genetic background with pink undertones, and then I don't see any lesions or wounds or incisions or any piercings except for the ones in your ears that I can see. I'm going to palpate your skin with my dorsal part of my hand. Is that okay?
Okay.
Sure you can see. Okay, palpating dorsally here, and then I'm going to go ahead and do the same right here. Skin is warm, dry, and smooth. And then I'm going to go ahead and pinch underneath the clavicle here for skin turgor. So I'm going to go ahead and down here, pinch, let go, one more time, and it is nice and elastic, so no tenting noted. The last thing I'm going to do is take a look at the patient's nails. So I'm going to take a look right here. So it does look rounded, it is pink, it is well groomed here, about 160 degrees, so no clubbing noted. I'm going to pinch a few fingers on both sides. I'm just going to pinch for a cap refill. Good. Pinching here, see if it blanches, and it is less than 3 seconds. And I'm going to do the toes as well. Pinch, pinch, pinch. All right, cap refill is less than 3 seconds, which means she has good perfusion. All right, that concludes my assessment today. Do you have any questions for me?
No.
Thank you for letting me do your general survey and taking a look at you and doing assessment. I'm going to put the bed in the lowest position. I'm going to put the side rails up. Bed lock. I am going to give you the call light over here. If you need anything, you press this button right here.
Okay.
Are you in any pain again to reassess your pain? Are you
No.
on a pain scale of 0 to 10? It would be a 0?
0.
All right, perfect. That concludes my assessment. Thank you so much.
You're welcome.
I'm going to go ahead and perform hand hygiene. And do you want your door open or closed?
Close, please.
Closed. All right. Thank you very much.
You're welcome.